All right. So welcome. We're so glad to have you here. So much. I'm grateful to see you guys today. And I just kind of wanted to talk a little bit about the healthcare landscape with you. Both Neer and Angel are here from Virtuous Benefits joining us. And we know as a business owner that your healthcare costs are one of the biggest, largest expenses for your business. And many employers think there's no way around it. And you may have even resigned to accept it. You've got employees that can't afford premiums, copays, or deductibles, and they're foregoing care often. So the good news is that the healthcare benefits landscape is changing. And by staying up to date with the changes, ultimately, you're going to affect your bottom line and provide better care for your employees. Employers now have a choice that serves their business and their employees while improving the bottom line. So we're going to ask today that you guys introduce yourselves, both Neer and Angel, Virtuous Benefits. We're so grateful to have you here thinking outside of the box about benefits and ways that you can help employers provide value to the health services. Can you tell us a little bit about how you got into this space today, Neer?
So our journey started when I helped my wife, Dr. Katrina Iqbal, about 9 years ago, start Direct Med DPC. And as we were educating individuals, couples, and families about high quality, affordable healthcare, we quickly started to realize that we really needed employers to understand this concept as well, so that we can really get propel the movement and get kind of everybody in the country to understand what direct primary care is, because it's so valuable for everyone's health and also for saving in a lot of the costs. And so my mindset was I needed to learn everything about that I could about insurance and sort of get into the health insurance industry so that I could teach employers how to create health insurance plans that completely revolve around the direct primary care model.
That's
And that
great.
made
And then Angel, tell us a little bit about yourself.
So I'm one of the partners at Virtuous Benefits, and I've been in the insurance industry for about 15 years. I started pretty young, and I actually started on the voluntary side, but quickly got into the health insurance model. And a lot of the stuff that we'll talk about, you know, I'm fair to say that I did a lot of the things in the first few years, just not understanding the industry, being put quotas put in front of me, and just trying to make a sale. But it wasn't until I really got more of a senior then I started understanding, well, I need to do what's right and start figuring out how to lower the cost and what's attributing to those factors. So that's when found out about DPC, found Near, and as he said, we just kind of joined forces and figured out together we can actually address the cost and provide higher quality care.
Yeah, that's great. So I really appreciate the expertise both of you bring to this area. And we understand that health insurance premiums are increasing by 10 to 30% annually with no end in sight, and that it's not sustainable for small businesses. But a good solution will require a fundamental understanding of the problem. And today we're discussing malaligned incentives being the culprit for rising costs, and understanding how your health insurance broker is being compensated is actually a fundamental part of understanding both the problem and the solution. Can you speak to that?
Sure. So that's a very important. I mean, most employers that buy health insurance go through an advisor or a broker, and they hire this advisor for that reason, right? They're getting advice for what's best for my employees, what's best for me. But as you mentioned, when the incentive isn't aligned, you may be stuck with the wrong advisor. And so understanding how they get paid is very important to addressing some of the high cost and if they're actually working in your best interest or if they're working in the best interest of themselves. And so one of the things I point out is that if your current broker advisor is getting paid a commission on the premiums that you're paying, then just think about that from a business standpoint. That means that when your premiums go up, they actually just got a raise. And so would there be an incentive for them to try to lower your cost? Basically, would they give themselves a pay cut if they can avoid it? And so that's important to understand. And then some of the things that also happen behind the scenes on the compensation side is all carriers, big or small, they have other incentives built in, such as, well, if you bring me so many groups or sell them, our insurance, we'll send you on a trip. You can go to Hawaii. We'll give you a bigger bonus. And so think about what that does to that advisor. Now they're thinking, well, I'm one group away from making my Hawaii trip, what do you think I'm going to recommend to you, right? If I need you to jump on this carrier, that's what I'm going to sell you, and I'm going to give you all the reasons why you should do it. So it's very, very important for a business owner to understand is that advisor or broker paid, so they can make sure they're looking out for the business and not for themselves.
Yeah, no, that's great. And then, of course, as a business owner, we know that delivering value is critical. And, this is one of the rare industries where it's almost as if there hasn't really been a choice, and the value is very low. And so having aligned the incentives, or, having a chance to align the incentives would really improve the value of the service being offered if the broker was compensated in a way that was beneficial to the employer and the employees receiving healthcare. But that is not the current existing structure in the traditional health insurance world. So, yeah,
Correct.
having healthy employees and decreasing the cost of your business creates tremendous value too. So when your employees are sick and they're unable to see the doctor and they have to stay out, that actually affects productivity. We know a healthy workforce is always going to be a more valuable workforce. And the main thing is we cannot keep doing things the way we've done them before and expect different results. And so I guess that's it. So understanding the fundamental problem, what are a couple things that you might recommend employers do differently going forward now that they've sort of got the basis of malaligned incentives?
Well, I would encourage them to have an advisor that's teaching them what's going on behind the scenes on a major carrier or a network carrier. Because again, we think as consumers, well, I have this big network, I have these options that I can utilize, I have a name brand that I recognize. That should be in my best interest. But once you start looking at how health insurance really is designed, you start thinking differently. And I'll give you a couple examples. So, the first thing that I always highlight is when you leave your doctor's office, whether that be a primary care visit, a specialist visit, or a hospitalization, the insurance company does not overnight them a check or send them a check within a week. They typically get paid anywhere between 2 or 3 months or even longer. And so, what do you think that does to the cost of care? That provider, that hospital, they have employees to pay, they have overhead. So, that's increasing the cost of that care. Then, when you look at, okay, well, what is the actual cost of this visit or this procedure? Again, when you run it through a network, they're going to add an administration cost on top of the actual care. And it's not just a few percentage points or a small admin fee. It is double, triple, or sometimes 4 times as much as the actual cost of the care. So again, you may think healthcare is unaffordable, but it's really the bloated administration costs that's making that healthcare unaffordable. And so understanding that within your own insurance plan is important because now you're starting to look at that network as it's not in your best interest, it's in the carrier's best interest. So we're big proponents of having an open network, going to anybody that you want for anything, realizing that every provider, every doctor, every hospital, they take cash, they take money. And a lot of them already have private pay or cash pay for those that are not insured. And so there's a ton of savings that you can find there just by looking at the network. The other thing that I point out that is also something we do different at Virtuous Benefits is we take you through an underwriting process, which means that we're going through health questionnaires just to find out the health of the group. Now, why is that in your best interest? Initially, that might seem like, well, that sounds a bit nosy. You're kind of getting into my business. Why are you doing that? Well, think about insurance at its basic level. Insurance is passing risk from one entity to another. So if I'm passing more risk to an insurance company, then obviously they're going to charge me more. Or on the flip side, if they don't know the risk they're getting into, then they're obviously going to charge more because they're not going to take that loss. So if you're 40, 50 years old, they don't know if you're healthy or if you're on 10 medications and going through a serious illness. So they always overcharge you for those for the initial coverage. Going through the underwriting process with us allows you to get immediate savings just by the simple fact that if your employees are working, going to work every single day, they have to be fairly healthy. Nobody can go to work sick every single day. So by having employees that show up every day, you already know that they have a fair, balanced health, and that's going to be in your best interest. So getting sometimes into the weeds about how health insurance works is going to be in the best interest of those employers that actually want to do something and not just take an excuse for why the healthcare is so expensive.
Yeah, so I mean, getting a second opinion and actually taking a look at the health benefits for employers as the second highest line item in the budget generally, and treating it like any other business expense where you actually analyze your options and take control of your spending and get another opinion, right? Because when you're getting the same opinion over and over, you're not going to get a different result. I mean, we call it the employer merry-go-round. You can shop all day long. You're going to go up and down a few percentages, and you're going to change insurers every year, but you're not actually going to improve the quality, and the price is not going to do anything but go up.
That's exactly right.
Yeah. Do you have any other thoughts about what employers might, utilize to control costs, or ways that they can learn more about what they can do to control the costs in their business and make sure their employees are getting good care?
Definitely invite them to look at our website, virtuousbenefits.care, so they can get a better idea of some of the things that we're talking about. And also, I would advise them start early. A lot of times the company waits until their open enrollment or their renewal period to call us, and then we're up against the clock. Hey, we need something now, and we got 5 days before everything goes back to normal. Do this mid-year, right? Do it sooner so that you have enough time to understand what we're talking about, understand what's happening, and actually make an educated decision.
Yeah, that's great. And then I would just say, employers really should just know their rights, right? So they're entitled to know how their brokers are being compensated. And honestly, it's the law. So there is the broker disclosure rule from the Consolidated Appropriations Act of 2021, and that requires the brokers to disclose their compensation. And in this case, with these brokers who are working in the traditional healthcare setting, it will become clear as a business owner that there is a structure and an incentive for them to sell a product, whether it serves you or not. And as your premiums go up, like we discussed early on, their compensation goes up. So I think it's really important for business owners to sort of understand whenever you think of your own business and how you hire, you're always structuring in a way that incentivizes employees to benefit the company, right? And so it's sort of like any other business expense. You're going to look at how it's structured and why. And that is a new law, and I guess employers can ask for those disclosures before signing, and should ask for those disclosures right before signing contracts, renewing or extending agreements. But like you said, I think getting in ahead of time to sort of know what your options are, so that when there is a contract to be renewed, you're not fumbling at the last minute trying to figure it out and starting from scratch. I guess the only other thing I'd ask is, that law being signed in 2021, have you seen a lot of employers? Do you know a lot of employers that are actually requesting those documents on compensation from their brokers?
So I will say it's hit or miss. A lot of the larger ones, employers do ask for that. Some of the smaller ones, that just aren't able to keep up with the laws that come through, it may get missed. But that is the tip of the iceberg, right? You have to first understand how your advisor is played to see if their incentive is aligned with yours, but definitely start asking for that so you can start understanding that part of the process.
Well, yeah, and as I understand it, they actually have a little bit of a fiduciary duty to their employees to ensure that they understand kind of all the intricacies of the healthcare plan. So whether employers like it or not, they're in the healthcare space. They're actually administering healthcare. And so it's important that they understand. And I think the more we can do to educate, the more questions we have, the more answers we'll get. So I'm really, really grateful that you guys were able both to join today. And if people want to reach out to you, how can they do that?
So again, our website is virtuousbenefits.care. They can message us directly there. info@virtuousbenefits.care is also available, but any way that they want to, it's available.
Yeah, and our phone number is 512-827-7925. They can text or call us as well.
Mm-hmm.
That's great. Thank you both so much. We really appreciate your time and you joining us today.
Of course. Thanks so much, Dr. Diaz.